bring up vitamin D again. So in my clinical practice, we treat a lot of patients with osteoporosis, osteopenia. I do a non-surgical sports medicine practice. And so very common. So here in Colorado, we have lots and lots of active people. And most people think, hey, I get some sunshine in, I take a little bit of vitamin D, my bones are going to be fine. You know, I'm exercising, I walk, I do some simple running, stuff like that. Well, that honestly is not the truth. Unless you're really finding out where your vitamin D levels are, you're not necessarily going to have great success in staving off osteoporosis and osteopenia, especially as women. Guys start to have troubles with their bone density, muscle density, especially kind of into the 50s, but they really accelerate between 60 and 70. So if you have a husband or this is a guy listening to this and you're in that 60 to 7 range, you really need to listen because it becomes super important, because if you maintain your bone density, you'll maintain your muscle mass, and muscle mass maintains your hormone levels, and that's what keeps us all healthy and living quality of life. So the patient I saw had an injury, and we were able to take some x-rays, and it was able to see pretty significant diminishment of bone density. And I asked the patient, I said, have you been tested for osteoporosis, osteopenia? Oh, yeah, I just went from osteoporosis to osteopenia now. So you went from one level to a little bit less level of density within the bone. And I said, so what's your family doctor doing about it? And she said, nothing. She just told me to stay on my vitamin D level. And I said, okay, great. What's the vitamin D level? And she said, oh, about 400 IUs. And I just couldn't believe it. So here's this woman sitting in my office with significant loss of bone density, also been tested to show that her bone density is going down. And a family doctor tells her 400 international units of vitamin D is going to be sufficient. And what somewhat frustrates me, so I started her on our bone formula that we use that has high levels of vitamin D, 10,000 IUs of vitamin D, calcium, magnesium, and zinc. So it has 1,200 milligrams of calcium, 250 of zinc and magnesium. And so the whole point of that is this formula is been well proven in the literature that this is how we build bone. So we put her on this, and so she decides to go back to her family doctor to get approval, and that family doctor went through the roof. Just, this is terrible. I can't believe a doctor would even suggest this kind of stuff. This is harmful for you. And so she comes back to me and she says, what am I supposed to do? I have now two very distinctly different diagnoses for me and treatment options for me. So let me give you the literature. So it's not my opinion. This is what the literature says. You need to be on high doses of vitamin D. It is not harmful for you to be on 10,000 IUs of vitamin D a day. It is not. Lots of studies. You have to understand all the study realms going on, right? Some are studying that in the endocrine system. Some are studying that for chronic disease. Some are studying that, for immune issues. Some are studying it in the neurological side. So there's all kinds of data out there about vitamin D doses and what's good and what's not for this, that, and the other. But in the musculoskeletal world, where I live, treating, muscle tendon injuries and bone effects, the literature is very strong. You need to be on these higher doses, and you need to be on this combination. It's well proven. You go into the literature, it is written down and showing the effects that high levels of vitamin D combined with the calcium, combined with the zinc, combined with the magnesium is what makes your bone get healthy. And so here's the issue. So the argument is, okay, why so much difference? Why do some people say 400 is dangerous but yet all of a sudden 10,000 isn't dangerous? Because vitamin D levels are not based on a hard stop. Like, hey, you pass this level, you will have troubles. So when you look at the literature, it's all over the place in terms of dosing. But when you look at single healthy people, young healthy people who have no disease processes, 400 IUs is enough. And if you have no processes else going on and no other disease problem going on, sure, you're going to probably get that too much and a little bit more vitamin D through the sun. And that may be too much. But if you're fighting a disease process, 400 international units of vitamin D will do nothing for you. So, and when you look in the literature, so a great study was done at the beginning of this year out of Belgium, looking at multiple sclerosis, right? This is a neurodegenerative disease that causes terrible problems and causes a terrible death. But high doses of vitamin D, the only thing that was done was high doses of vitamin D. 200,000 international units weekly, which equals out to about 7,000 IUs of vitamin D daily, put MS into remission. And it put it into remission for over 2 years. That's ridiculous. This is a disease that we have no treatments for, we have no cure for, we have no way to calm it down, but we give them high doses of vitamin D and no negative effects, no problems, no toxicity. What happened? Our body has a tremendous flexibility to utilize vitamin D, especially when there's disease processes going on. And so when you have this chronic significant neurological condition, our body can accept more vitamin D safely and with good effects, good positive health effects. So when people do these absolutes, no, this is the number, you can't go over it, they're just totally discounting all the literature that says you have to go over this in order to get the better health effect. So in the musculoskeletal world, it's been real proven that if we want to turn around osteoporosis, we need to get high doses going. So with the bone formula that we use, we start them out at 10,000 because we need to start bringing those doses up. So, and when you look on blood tests, the typical levels you'll see on a blood test is the low is 30, the high is maybe 100. And so most people that you test with vitamin D, and I'd say this is primarily women. I'd say probably 20% of our patients are men for this. You'll see them in the low ranges, 30s, 40s at best. Well, what the studies show that women need to be at that 70 level, right? And the 70 level says, hey, 10,000 IUs of vitamin D, the studies have proven will get you to that 70 to maybe even 80 level of milliliters of 25 OH. And that's the chemical term that we're testing, right? So when you do that, the studies show significant improvement in bone density, significant reduction in fracture rates, significant increasement in muscular strength and functionality. So they have less risk of falls, and less risk of falls means less risk of fractures. Okay, why aren't we doing this, right? So the argument again, so this patient I had was told that she's going to get toxic on my levels, but here I have multiple studies showing at that high levels and actually higher showed greater benefit for her bone structure, for reestablishing bone health. One of the studies showed a 78% increase or decrease in risk of bone injury and falls by adding that higher dose of D in combination with the calcium, the zinc, and the magnesium. So what you have to understand, when you're going to your doctor, you need to be asking your doctor, what are you reading to say that this absolute is the absolute? All right. So I want to go back real quick. So the combination, it's really important because I have a lot of patients who come, I said, okay, hey, your bone density looks a little low, so what are you taking? I'm taking a little vitamin D. Oh, okay. Taking anything else? No, just vitamin D. Or I have a lot of people come in, no, I'm doing calcium. I'm just taking calcium. I heard that helps. And I get into the sunshine. Again, you're falling short. Whenever you have bone density issues, and we all will have them. If they're the lucky one who doesn't have it, good on you. But every one of us will suffer with bone density issues as we age. It is unavoidable. So if you have bone density issues and you want to maintain quality bone density, you have to do all of this in combination. So vitamin D, what does vitamin D? Vitamin D helps calcium metabolism. So i.e. you get it through the gut better. So what else does vitamin D do? Vitamin D makes sure all these minerals are getting stuffed into your bone and they're staying there. There's two other enzymes, calcitonin from your thyroid and gastrin from your gut, that's trying to pull that calcium out. And if you don't have high vitamin D levels, the body will pull the calcium out. And high vitamin D levels keeps the calcium in the bone. So again, we need those higher numbers. This is the musculoskeletal literature that says this. You need these higher numbers And if you don't have these higher numbers of vitamin D, you can't keep calcium where it's supposed to be. But then calcium isn't enough. If you just have calcium, there's nothing to make the calcium work. Magnesium is what activates the calcium, so you want to start building the bone structure. So great, I'm taking vitamin D. Who cares? Great, I'm taking calcium. Who cares? Great, I'm taking them both. Who cares? You're still going nowhere. If you don't bring the magnesium in, you don't activate the process. It's like a cook having all the ingredients on the countertop, but never starts the fire. You ain't going to cook anything. You're not going to make bone if you don't have the magnesium to activate the calcium to become what we call hydroxyapatite, the bone structure. And the final thing is, what's zinc do? Zinc makes, there are two key cells in our body. One is called the osteoclast that breaks the bone down, and the other one is called the osteoblast that builds the bone up. Zinc, so when you're in low bone density, you have what we call osteoclastic activity. It's breaking your bone down. So that cell we want to stop, and we call the osteoblast, we want to build. So we want to stop the bad and start the good. So how do you do that? Zinc. Zinc makes the bone stop breaking down and creates the function that wants to build the bone up. So when this doctor is telling my patient, you're going to have troubles, this is dangerous, she is coming from a point of ignorance because of the literature she's reading. I don't fault her for her idea. Yes, vitamin D levels in healthy people, and if they're too high, can be dangerous. But in older people with osteoporosis and already proven osteoporosis into osteopenia, it is not. And it becomes imperative that you get these supplements on board at the correct levels. So we have to be very careful when we're listening to our doctor. I don't want to beat the doctors up, but my job is to pay attention to this literature, because this is what people come to me for the health of their musculoskeletal system, their bone system. Because we know if the bones are healthy, your muscles are good, and your muscles are good, your endocrine system is good, meaning all your hormones, and you live a quality of life. But if you lose that, then you're going to suffer. Just next time you go see your doctor and they do a blood test, or you're being told you have osteoporosis or osteopenia, you need to consider these. This is the way you're going to get better. And the good news is I can say I've been using our bone formula for many, many years. The current one we have now for, well, close to 10 years with excellent success. And as far as I can say, I have not had anybody come back with any complications or difficulties. But on the same side, I can say we have had many women patients in particular have returned back to healthy, stable bone densities and reduced their risk of bone fractures or falls substantially. It's winning the simple. It doesn't take a drug. It doesn't take Prolia. I'll give you my last example. I had a woman recently who has been on Prolia twice. So normally you can do a 5-year term, and then you have to come off of it because it could be causing bone injury or weakening of the bone. And then you can go on it after a 2-year break. Then you can go on it for 5 years again. If you do that twice, you're done. And you can't repeat that, because the risk is the bone becomes too weak and it can cause a spontaneous fracture. And so I asked this patient as she was finishing her second round, what are you going to do now? She goes, I don't know. Do I need to do something? And her bones were almost translucent. And I said, you definitely need to do something. And again, her doctor said, we've done what you're supposed to do. This is going to be safe. But the literature says the likelihood of her fracturing a major bone in her body, like her femur, is very, very high. Within probably the next 2 years, she'll probably suffer a fracture. And again, the medications work to secure or strengthen the outer bone, but they don't secure or strengthen the inner bone. And the inner bone is where the strength is. I always use the example of the Statue of Liberty. When you look at the sheeting around the Statue of Liberty, looks fantastic, right? She stands fine in the New York Harbor. Go underneath and look up and see all the rust on the I-beams, and you're going to say, this lady's going to fall. Because if the I-beams aren't good, who cares what the outside looks like? That's your bones. Who cares if the outside looks good? That's what the bone density tests do. That's what a bone scan does. It just tests the outside of the bone. It doesn't tell us the inside health of the bone. And it's the inside health of the bone that holds us together. So these DEXA scans that everybody's relying on, you're only getting a measurement of that outside bone, not the inside bone. And that is creating this significant problem. Many people think they're fine when they're at big risk. And my last and final point, if you want it tested right, the only way to test bones correctly for their density is what's called a quantitative CT. And those quantitative CTs are now under investigation in America through the FDA. They've been under a year-long investigation, and they should be coming clinical very soon, within the next year for sure. This is the test that's going to really tell you what the bone density is. So remember the term quantitative CT, and as soon as those are available, if you have bone density issues, that's the test you need to determine where you're at.